Okay, good morning, good afternoon, good evening po sa lahat. Saan man po kayong panig ng mundo naroon. Welcome to our 164th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. At kung sino man po ang first time pa lang po makakasama, sana po ay mas masiyahan po kayo that you're spending your lunch hour with us. At we really look forward na mas marami pa po ang mag-join ng ating credible online community para mas lalo po tayong lumago at mas lalo pa po tayong lumaki bilang isang komunidad learning together with regards to health topics in general and preventing preventable deaths. Tobacco use, yung po ang ating topic is smoking cessation. Tobacco use remains a pressing public health issue in the Philippines, posing a significant challenge to the nation's well-being. We will have a comprehensive exploration of the Filipino smoking landscape and also delving into the prevalence of smoking across different regions, other factors that influence tobacco use, unique challenges faced in the Philippines in terms of combating this public health crisis, and helping us understand the nuances that are essential for tailoring effective interventions. Very paramount din po ang cultural sensitivity when we're addressing smoking cessation dito po sa ating bansa. So hopefully we'll be able to be provided with guidance on how to approach smoking cessation discussions with respect for diverse backgrounds and beliefs. As we explore the importance of cultural competence, building trust, ano po ba yung kailangan in terms of building rapport, ano po yung mga interventions that will be needed in terms of enhancing the likelihood of successful smoking cessation outcomes. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. And as mentioned po, no, very, very happy that we're here again magkakasama. Today, my co-host po again will be Dr. Angela Season Aguilar, who is a Special Assistant to the Dean for External and International Linkages at the UP College of Medicine and the Philippine General Hospital. I think that she's just having some technical issues lang po with regards to joining, but very, very soon she'll be joining us later on in the program. So, hello din po, as she would say, in terms of those who are watching via live streaming sa ating TVUP YouTube channel as well as on the UP System Facebook page, TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, all those who are watching us from the TVUP Signal TV channel 101. During our webinar for today, we have an excellent lineup of speakers po, no? Our main speaker is Dr. Lenora Fernandez. Ma'am Lenny is the project leader of the update on the Philippine Smoking Cessation Guidelines commissioned by the Department of Health, also a member of the WHO Guideline Development Group on Smoking Cessation and the head of the Stop Smoking Program, as well as Professor-in-Chief of the Division of Pulmonary Medicine at the UP College of Medicine and Philippine General Hospital. We have two reactors for today. Dr. Glina Ong Cabrera, serving as the chair of the Council on Clean Air, Tobacco, and Air Pollution of the Philippine College of Chest Physicians, as well as coordinator of the DOH Quit Smoking Hotline. And then our second reactor po is Dr. Benjamin Vista, who is an associate professor and head of the section of Addiction and Dependence Medicine at the Department of Psychiatry and Behavioral Medicine of the UP College of Medicine and Philippine General Hospital. Synthesis and closing remarks to be delivered by Dr. Stella Marie Jose, who is the head of the Office of Hispanic Education and Training at the UP Philippine General Hospital. You have seen in our opening billboards po now that we have transitioned to broader discussions on how the pandemic has affected health outcomes beyond COVID-19. We have maintained, as you will notice, maintained yung pong brand po and name po natin, Stop COVID Deaths, and have expanded our discussions. And since we know po, no, all of you are very, very interested. Hello, Mamangge, how are you?
Hello, sa wakas na volcanic smog ata yung aking connection. Buting-buti na lang at tayong IM pulmonary medicine that will be able to help us with this our
yes,
timely
Ano nga po the news is really a bit timely just because we have this Taal Volcano Advisory tungkol sa volcanic smog alert, and for communities that can be affected by the VOG, yung kaya volcanic smog alert po, no, to be mindful of limiting their exposures and protecting themselves. Right now, Ma'am Angge, we will be going po to our news updates. And since we know that you like to be abreast of the latest news in health and medicine here and abroad, we have a segment in the webinar called the News Updates. Okay, for our very first news update po, actually our two news items are from the World Health Organization, but for our very first one, the World Health Organization, WHO, welcomes historic commitment by world leaders for greater collaboration, governance, and investment to prevent, prepare for, and respond to future pandemics po. Last September 20th, the World Health Organization welcomed historic commitment shown by global leaders at the UN General Assembly. Ngayong week pong ito po kasi na nakaraan, itong patapos na po, is the United Nations General Assembly to strengthen international cooperation, coordination, governance, and investment needed to prevent a repeat of the devastating health and socioeconomic impact caused by COVID-19, make the world better prepared for future pandemic, and get back on track to achieving the Sustainable Development Goals. Yung pong political declaration na naganap, approved by the President of the 78th United Nations General Assembly, and the result of the negotiations under the able leadership of ambassadors of Israel and Morocco, it underscored the pivotal role played by the WHO as the directing and coordinating authority on international health, and the need to commit further to sustainable financing that provides adequate and predictable funding to the World Health Organization, enabling it to have resources needed to fulfill its core functions. So very, very important po, no? And the Director General po of the WHO, Dr. Tedros, said governments and multilateral partners have already commenced building the foundations for a safer world with the establishment of what they call as the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the WHO BioHub to voluntarily share novel biological materials, and the mRNA vaccine technology transfer hub. So all of this really is a testament po on the collaborative efforts of the different governments and the critical importance of pandemic prevention, preparedness, and response, and the need for a robust, coordinated, and comprehensive global health emergency architecture. For our next news update, given by Ma'am Angge.
Okay, ako naman, Doc Raymond. This
Yes,
time, this is about world leaders committing to redouble our efforts towards universal health coverage. And this is has been set with a new target of 2030. So we have how many? 7 years to be able to accomplish this. The UN General Assembly high-level meeting of world leaders have approved the new political declaration on universal health coverage. This is very timely. Tayo sa Pilipinas, kasama po tayo dito because we want to expand our ambition for health and well-being in a post-COVID world. So this is a very important political declaration. It's a turning point. It has many governments all around the world will have to do a course correction towards key national actions. They have to commit not just their politics, but investment. They have to make their essential investments to strengthen international cooperation and global solidarity to accelerate progress towards UHC by 2030. And this is to be accomplished by a primary healthcare approach. So the WHO commends member states for approving the second UN high-level meeting of political declaration on UHC because this is a broad consultative process. So dapat lahat tayo kasama din ang Pilipinas dyan, and we are fully committed as a member state and a partner to ramp up policy actions of UHC for better service coverage, to ensure financial protection, and to shape the financing architecture to invest more and better health. So if you notice, medyo malaki ang commitment in terms of finance kasi that's one of the very important roads that will lead to universal healthcare. So this was discussed, and the next will be updated in 2027. So that's it for me, Raymond. Go ahead.
Thank you so much, Ma'am Angge. And that's the news for this week. Magkita-kita po tayo again next week for our news update.
So balik
Okay.
tayo, webinar topic na tayo. Go ahead, Raymond.
Yes, ma'am. Opo. So for our webinar po, no, but they really will start off po muna with setting a discussion into context. Ma'am Angge, I know you really are looking forward to learning more about smoke-free Philippines. Paano po ba yung magagampanan? Pero as we have been doing po in previous webinars, we'll need to understand kung ano po yung nasa utak po ng ating mga persons on the street through this very, very short video from TVUP. They ask the questions, the following questions po. No? Ikaw ba ay naninigarilyo? Nasubukan mo na bang tumigil sa paninigarilyo? Ano ang iyong karanasan sa pagsubok na tumigil manigarilyo? Nagsubok ka bang mag-vape? Ano naman ang inyong opinion sa vaping? At sa tingin nyo ay may masama bang epekto ang vaping? So please watch this.
Opo.
Opo.
Minsan. Occasionally lang naman. Kaya ko naman tumigil ng free will ko.
Nasubukan ko na.
The-dry po yung bibig ko, naglalaway din. And at the same time, irritated.
Mga karanasan, siguro yung palaging mainit ang ulo ko. Na parang may hinahanap ka na parang kang naglalaway, ganyan. Kasi parang iba yung feeling kapag talagang everyday kang nagsisigaret eh. Iba yung feeling na bigla mo siyang ititigil. Alam mo yun. Actually, nag-attempt ako pero hindi rin naging successful. Ayun, bumalik pa rin ako.
Actually, wala naman kasi hindi man talaga ako chain smoker or malakas magsigarilyo. Siguro, isang beses sa isang buwan, ganun, parang ganun.
Vape, yes. Actually, 3 ang vape ko.
Okay naman po, mas feeling ko mas safe siya dahil hindi siya tobacco eh. Pero mabilis ko rin pong tinigil.
Yun, vape ang lagi kong gamit. Sa vape, parang sa akin ay hobby na siya eh. Nung napalipat sa vape, medyo compare sa sigarilyo kasi mas hinahapo ako sa sigarilyo eh, kumpara sa vape. Sa vape hindi masyado eh.
Vaping, hindi ako satisfied. Iba pa rin sa akin yung cigarettes talaga na nalalanghap mo talaga at dama mo hanggang buto.
Feeling ko po yung defect yung lungs mo and magkakaroon ka ng sakit.
Siguro pag madalas or sobrang taas ng meron kasi siyang nicotine level eh. So depende sa kung ilang mg ang ginagamit mo na nicotine.
Yun nga eh, saglit lang ako nag-vape. Hindi ko talaga siya feel. Mas feel ko ang cigarettes. Although parehas naman silang may bad effects.
Kung naninigarilyo ka tapos nagbe-vape ka, siguro masasabi mo na mas malaki yung difference ng paninigarilyo sa vape kasi sa vape is actually vapor siya kumpara sa sigarilyo nasusunog yung hinihitit mo.
Wala naman po eh. It's just the flavor and at the same time yung isa leaves, yung isa juice.
Much better kung i-quit na talaga. Pero sa katulad ko na kapag konting stress, cigarettes, ayun, sobrang hirap. Pero I will try naman siguro. Hindi lang siguro ngayon, pero soon.
Gawin nyo lang kung saan kayo masaya. And kung di nyo naman trip mag-yossi, kung gusto yung tigilan nyo na lang din.
Okay, thank you so much, TVUP. Something
Oo.
of an eye-opener po, no? With regards to how the youth is viewing po smoking and comparing it to vape. Parang yung iba mas gusto nilang mag-smoke in terms of and kumpara sa vaping, mamangge.
Yeah, napakalaking controversy yan, di ba, Raymond? Kasi isipin mo, some would say that we have to switch to vape, which is safer. but other experts would say that it's actually problematic and will actually promote rather than help people who have the habit. So talagang we really need this discussion right away, di ba? Doc Raymond,
Yes
go.
po. Yes po.
Oo.
So before we start lang po, Mamangge, with our webinar proper, we'd just like to have a few housekeeping rules lang po. No? Certificates of attendance, again, be given to those who have watched at least 50% of the webinar duration. If you feel you should have received one but did not, please let us know at stopcovides@up.edu.ph. We have already sent out all of the webinar certificates up until webinar 163. So we hope that everyone who should have received it must have received it na po. And then for today's webinar, we'll be having a standard panel discussion format after our speakers have presented. That will be followed by a Q&A session. And as mentioned, before we delve into the webinar po, I know everyone is excited. Pero ingat lang po if you're outside just because of the volcanic smog. We'll start off po muna with this very short but cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, can't help but smile. Can we have the questions po in the Zoom as well as in Slido po, and we'll go ahead with those two questions. Okay. For those who are joining us outside of the Zoom, whether you're on Facebook po or in YouTube channel po ng TVUP, you can still participate in our fun quiz by opening up your browsers, entering po in the address bar slido.com, and when you are prompted, input po ninyo yung numerong 6510096, that's 6510096 for you to be able to participate in our fun quiz. We have two questions today for our fun quiz segment. At dito po ay first question, what are the ABCs in helping smokers stop smoking? So is it A, ask, brief advice, and counsel? Is it B, ask, brief advice, cessation support? Is it C, advice, brief support, convince? Or D, na ABC, ask, brief support, at counsel? So alin po dito ang tamang kasagutan? We'd like to take this opportunity to greet those who are joining us all the way from Oriental Mindoro Provincial Hospital in Calapan City, Oriental Mindoro. Provincial Health Office in San Jose City, Nueva Ecija. Iloilo Doctors Hospital Incorporated in Iloilo City. Western Visayas Medical Center in Iloilo City as well. Valladolid District Hospital in Negros Occidental. Zamboanga del Sur Medical Center in Pagadian City, Zamboanga del Sur. IR3 HSCP Dialysis Center in Digos City in Davao del Sur. Also those from the Deca Homes, Loma de Gato, Marilao, Bulacan. Maraming salamat po. From Zamboanga City, from Cebu City, San Fernando, La Union, malayo po. From Malay, Aklan, thank you so much. Morong Rizal, maraming salamat po. From Laguna, from Bataan, from Diliman, thank you so much. From RPHS Annex 1 in Antipolo, ang ating pong mga regulars from the University of Santo Tomas Hospital, ENT HNS Center, maraming salamat po. From La Consolacion University in Malolos, Bulacan, thank you so much. At doon pa rin po sa ating mga tagapanood from the Philippine General Hospital at sa ating pong ibang constituent universities. For question number 2 reads, the following are established harmful effects of vaping with the exception of A, acute lung injury or EVALI, na letter B, popcorn lang. Letter C, gateway smoking, or letter D, none of the above. Yes, you will note every Friday po may mga kasama po tayo na nanonood from outside the Philippines, especially today from the Chuanin Hospital in Taipei City in Taiwan, from Los Angeles in California, Al Meswak Dental Clinics in Taif, Saudi Arabia, Canadian Medical Center in Dammam, Saudi Arabia, University of Hail in Hail, Kingdom of Saudi Arabia po. So, we encourage everyone to participate po dito sa ating fun quiz. Will not close po, at least dito po sa may Zoom at doon po sa may Slido, as Ma'am Angge moves forward with introducing our main speaker for today.
Ayan na nga, let's go. So I know that everyone is excited to get the webinar on the way. So let me introduce our main presenter. Nako, idol na idol ko si Ma'am. Nagre-refer talaga ako sa kanya. Our main presenter is the project leader of the update on the Philippine Smoking Cessation Guidelines commissioned by the Department of Health, member of the WHO Guideline Development Group on Smoking Cessation, and the head of the Stop Smoking Program, as well as the professor and chief of the Division of Pulmonary Medicine of the UP College of Medicine and the Philippine General Hospital. Let us all welcome Dr. Lenora C. Fernandez. Ma'am Lenny, please. We can see your slides now. So, Dr. Lenny, you can unmute. Ayan, I can see you na po. Thank you.
Okay. Good morning to all. Thank you, Angge and Raymond, for introducing me. And we will be talking now about the personal smog, no? Which is smoke. This is not the bog, but this is much in vogue right now, especially with the vaping epidemic that we're experiencing in our country. So I hope we will you will join us in our fight or in our quest to help our smokers, because it's really as easy as ABC in helping our smokers stop smoking. So I hope that we'll be able to understand how easy it is to help our smokers stop smoking. And we'll have some updates about the guidelines on how we are trying to help everybody at the front line, as well as throughout our country, again, to help these smokers stop smoking. So good news muna. No? Ang good news natin, in the 2021 Global Adult Tobacco Survey, we saw that there has been a decline in smoking. So lahat naman ng efforts natin so far has been successful. So there has been a 34% decline in smoking, with only now 20% still continuing to smoke. However, so syempre kung merong good news, meron din po talagang bad news din. Ano po ang bad news natin? Sa mga natitirang naninigarilyo po, still a lot of them continue to smoke. And as we can see here at the right side of our slide here, you can see that only 4% have actually succeeded in stopping smoking. Ang problem po natin, from this survey that was done in 2009, 2015, and then 2021, the interest in stopping smoking among our smokers has dwindled, has been decreasing. And our effort to advise our smokers to stop smoking has also lessened from 56.5% to only 54.5% of our smokers receiving the advice for them to stop smoking. And how many among those who were advised did try to make a quit attempt? You can see here, only 45%. From 3 years ago, 52% did try to make an attempt to stop smoking. And as I mentioned, only a few were really able to stop smoking, and only 4% lang po. So ano ang difference po natin from those who made a quit attempt and among those who really stopped smoking? That's a staggering 42%. That's the gap which we need to fill as healthcare practitioners to help our smokers stop smoking. So that is the bad news, that we still do have a lot of things to do. The smoking behavior persists. It's really long-term. We consider it now not just as a habit. Yung sabi nga nung isa na in-interview, parang sabi niya na madali lang naman mag-stop mag-smoke kung parang habit lang ito. But apparently it's not. It is a disease which is chronic, relapsing. Therefore, we consider it like hypertension, like diabetes. And the name of this disease is nicotine dependent syndrome. May ICD-10 po ito. F17.2 po ang label natin dito. And our proof for that is that, as we saw, only 4% were really able to quit from the 45% who tried to. So few tobacco smokers really achieve permanent abstinence after their initial quit attempt. And as we mentioned, many would try to quit, and hopefully we will push them or help them really stop smoking after probably 2 to 5 attempts along the way. So it's important for us to have that mindset na huwag tayo ma-frustrate, huwag tayo ma-depress. Sabi ko kay Ma'am Grace kanina, nakaka-depress medyo ang news natin about the VOG and about the continued smoking. But let's be calm and be prepared to help our smokers along their journey to stop smoking, because it will be a long struggle. Ang PhilHealth po, sa totoo lang, meron pong reimbursement kung tutulungan natin ang smokers to stop smoking. But it has to be done inpatient. So there's a 7,800 pesos case rate if we handle our patients to have nicotine dependence syndrome. So kung saan man tayo ngayon, kung sa Zamboanga tayo, sa Pagadian, nakapunta na po ako dyan. And then kung nasa Iloilo kayo, nasa Saudi Arabia, or may isa taga Jakarta po, it's easy probably for us to help our smokers stop smoking if we really have the heart also to help them along this long journey, kasi maari po talaga maging long journey siya. So ano po ang sagot sa ating test question kanina sa quiz? ABC would mean A, ask, B is brief advice, it just needs 3 minutes of your time, and C is cessation support. So in-emphasize natin na cessation support po ito because it can go beyond counseling only. But C, yes, it can stand for counseling, but you can provide also something bigger or more than counseling. So A would be ask at every encounter, do you smoke or vape? Now, if we routinize it and if we have a system, we can make it something simple, and then we can catch more smokers along the way. So my classmate earlier was telling me, si Dr. Wen, she's in the audience, that she wasn't able to detect her loved one that he was a smoker. Now, if in our clinic, if all of the patients that we see, or even among our surroundings, if we do take the time to just ask that simple question, and it's really part of your system, gusto nga natin maging fifth vital sign. Kakalabanin namin yung anesthesiologist about the fifth vital sign being pain. Gusto namin yung smoking status ng pasyente. So let the person know that you ask, because if you ask, then it will now be part of your job. And do not judge. So hindi tayo judgy kapag makita natin na isang smoker, or if we are able to catch somebody. Letter B, brief advice. So advise all smokers or vapers to quit. And of course, we try to make it relevant, something personalized, yung message po na yun. And then we discuss, of course, now the risks of them continuing vaping or smoking and the rewards that they will get. So it would be a pros and cons thing, so that they can now themselves decide by themselves to really consider stopping smoking. And C, as I mentioned, is cessation support. It's not just counseling. But before we go into what can we do for our smokers, of course, we have to understand kung ano ba nangyayari talaga sa katawan ng isang naninigarilyo or nagbe-vape. So we saw our vapers and our smokers say that iba-iba yung epekto sa kanila. So all of us probably know this already, that the problem with this very simple cigarette stick is that there will be a sudden upsurge of the nicotine in the brain. In 15 minutes, it's already there in our brain, and then it will gradually go down. So this gradual dip in the sudden upsurge and then the going down of the nicotine is the one now which would cause our brain to like the effect of smoking. So the nicotine would increase the chemicals like dopamine in our brain, and that now leads to the nice things that they would experience. Ang maganda po sa nicotine compared halimbawa sa alak would be it's both an upper and a downer. So it's an upper, it can arouse you, it can help you focus or concentrate on your tasks, pero nakaka-lessen din siya or alleviate ng anxiety. Unlike si alak, medyo aantukin ka lang, medyo ida-down lang yung mood mo, pero hindi siya nakaka-help mag-focus. So this is the nice thing about nicotine in terms of its effect in the brain. And of course, as you continue now to smoke and to vape, then you develop tolerance and physical dependence. And then one of the interviewees kanina said that he did experience, or she did experience, withdrawals when she stops smoking. And then the cycle continues there. So is it just something functional or chemical na pag-stop mo ng sigarilyo, pag-stop mo ng vape, wala nang maging matitira na epekto sa ating utak? nakita po nila with functional imaging that the permanence in terms of the effect in the brain can really last. So nakakatakot po lalo na sa mga youth natin na nagbe-vape na sila at this time, that there are already changes going on in the frontal lobe of their brain, and that can persist. So this is one thing that they are still investigating because the knowledge about this is not yet that solid at present. So we mentioned the nicotine dependent cycle. So what the actor na in-interview kanina, naramdaman niya yung withdrawal. So yes, it does happen because once the effect of the nicotine is gone, then of course you can experience that. So ito po ang pag-handle natin sa pasyente, no? When they now try to stop smoking, that we know that the withdrawal symptoms can last for a month or even more. So that's why we help them along this long journey of stopping smoking. And again, as I mentioned, if they would relapse or go back to smoking, huwag kayong mawala ng pag-asa, huwag kayong ma-frustrate because it really does take around 3 to 5 cycles before they would really permanently stop smoking. So C, cessation support. Ano po ito? This would now be the assess and the assist part. We have to assess how severe or how intense is the dependence in terms of the effect of the nicotine in the brain. And that would just mean asking the question, are you ready to set a quit date within the next 30 days? So assess if they're willing to stop smoking at that time. So if they would say, no, I am not yet willing, then that means your patient is in the pre-contemplative stage, in the stages of change, as we would say. And if they would say yes, then banat na tayo, tutulungan na natin sila ngayon to help stop smoking. So they would be in the contemplative or even in the action stage. And then syempre, kung babalik sila ng paninigarilyo, they'll be in the relapse stage. But again, cycle lang tayo na cycle dyan. Tulong pa rin tayo ng tulong sa isang pasyente. And this is what we aim for, that they will now really stay quit from smoking lifetime. So syempre, kapag yung pagsabi ng pasyente o yung tao sa'yo na ayoko pang tumigil magsigarilyo or mag-vape, then that means they are in the pre-contemplative stage. And we know the chances of us not succeeding in helping them stop smoking at that time will be really very high. So we can see here the success rate in helping a matigas na ulo na smoker at that time is low. So, but there are now techniques where we try to help them slowly, bring them to the point where they can probably be in the contemplative stage. So there will be techniques for that. And I'm sure you've learned some of those along the way. So if they're ready to quit and we assist them, we just make it simple. We have the STAR, and then we make use of referrals now to support our smokers who would need help. So the DOH has a very nice quit line. The number is 1558. So wag niyong kalimutan po yan, 1558. Si Dr. Glina will tell us about their experience there. So it's easy to get online here with them, and then they are there to help. Kami sa PGH, we have a formal stop smoking program, and this is our contact number here, 0961-899-1263. DOH of Lung Center also has one, and try now to ask in your locale if you do have a formal smoking cessation program too. So the Lung Center quit line has been very successful. We can see here a 63% quit rate from the quit line enrollees, and the main reason they said that they really stayed quit was because mostly of health-related reasons. So in the stop smoking program in PGH, before we used to have a 62% abstinence rate also. So we have a 3 to 4 week program in PGH. So what did I mean by you having just a simple plan for your patients or the smokers whom you want to assist? It would mean the STAR. S would be set a quit date. T, tell the family, friends, ito po yung sinasabi natin sa mga naninigarilyo, to help them stop smoking. A would be to be smart, to anticipate the challenges that will lie ahead from that journey. And then R would be removing tobacco products. And another R would be to reward yourself if you're successful in stopping smoking. So S would mean set the quit date. We want it to be within 2 weeks that you will quit. So hindi pwedeng, uy, ang Pasko, nandito na si Jose Marichan, no? Sumisilip-silip na. Pwede bang December 25 na ako tumigil manigarilyo? So it cannot be. It has to be as soon as possible. So usually within 2 weeks if it's possible. Tapos, yung mga pasaway ng mga barkada na kasama sa paninigarilyo, siguro sasabihan niyo sila na lumayo kayo sa amin, no? Or they should stay away from the smoker at that point in time. So just surround yourselves with those who will help you in your quest or your journey again to stop smoking. And these are the other coping skills that we usually tell our patients. Physical activity would be a good substitute to smoking. And then deep breathing and stress relaxation, mindfulness techniques can be done also to help patients stop smoking. So as we mentioned, the Department of Health commissioned the PGH to have an update on the smoking cessation guideline. I'll just share with you some small tidbits that can help you along the way in your job as a frontliner. So this would be the link that you can get hold of a copy of this updated guideline. So it was really a village that took that worked to make this guideline possible. The Philippine College of Chest Physicians was very, very helpful, and they were there along the way to help us, aside from the other societies. So the thing that I would like to emphasize that we looked at in the guideline was, do we need medications to help our patients stop smoking? So our data would show that yes, it does really help our smokers stop smoking if we provide pharmacotherapy or medications to help them stop smoking. We can see here the odds ratio, which is quite high. And therefore, the recommendation then was to have pharmacotherapy possible. And if you can get that as part of your MOOE in your local health center or in your hospital, then kindly do so. So what is available right now, unfortunately, is just nicotine replacement therapy here in the Philippines. Varenicline is the other drug, but I won't discuss it already too much because recently it has been also difficult to procure it. So whom do you give pharmacotherapy to? If possible, all smokers, except if they're just light smokers, which would mean less than 10 sticks in a day, if they're pregnant probably or breastfeeding, and adolescent smokers also. Data is not that good in terms of helping them stop smoking, or if they have medical contraindications. Otherwise, we have that mindset to help them in that nicotine dependence syndrome to give pharmacotherapy as much as possible. So the nicotine gum is the most available right now. So the ones available in the market would be the 1 and 2 milligram. So ang bilang po natin yan kung ilang sticks ang sinisigarilyo ng smoker, yun din ang number of gums na ginagamit usually ng pasyente. So I usually tell them to have 1 piece every 2 hours when they are awake, of course, to help them combat the craving and withdrawal. So ito po ang kailangan nating alisin din sa utak natin na if we're talking about the same thing, this is nicotine. So is this like a paradoxical thing? So the nicotine gum does not cause dependence at all because gradual ang akyat ng concentration nito sa body and then it lasts for a longer time. So it does not have the same effect as vaping nor with cigarette. But it now lessens our need for the vaping or cigarette because of the effect, because of the nicotine content. How do we use the nicotine gum? So hindi yan kapareho ng mga ibang chewing gums po natin. Kailangan siyang i-chew, tapos i-park sa gilagid, and then when the taste is gone, then you chew again, and then park it again, and then until it's gone, and then you now change it with another gum. So that's how to use the nicotine gum for our patients. Do we get side effects from the nicotine gum or the nicotine patch, for example? Yes, side effects may happen, but they were very minor. Even for patients with cardiac disease, basta lang hindi recent yung heart attack nila. And if, for example, if they really have a very bad heart, then of course you get a cardiology clearance. But otherwise, it is even safe for patients with cardiac disease because the serious cardiovascular events have not been significant with the use of the nicotine gum. So, we also have those sabi nating matigas na ulo or they're not yet really ready to quit. So there are the what we call pre-contemplative smokers. Do we do something for them? Of course, we still assist them to think about quitting in the future. So nandito tayo, hindi tayo magpapagalit sa kanila because judging won't get you anywhere. So they would just create a barrier immediately and they won't listen to anything that you will say. So tobacco users who are not ready to quit today may be ready the next time you see them. So do not pressure them into quitting. And we just offer self-help materials at that time. So in our guideline again, we will go now to the topic of vaping or e-cigarettes. So this is now our next topic. This is the picture of my vapor patient who had actually abnormal ECG. He had a mild CT scan finding also. And look at that. It's so dirty, no? The mouthpiece from their vape equipment. So what is the frequency or the prevalence now of vaping in the Philippines? So this is our new enemy at present. In the GATS 2021 among adults, it's just 2.1%. There are also what we call heated tobacco products. Ito po yung mga IQOS. 0.1% po ang frequency ng gamit sa Pilipinas among adults. How about the youth? In 2019, it was 14%. And with the bill now lowering pa further, no, the limitation to buy a vape to 18 years old, I'm sure this is much higher now. So this is the scare at present. And in the guidelines, we look into this as to the benefit and harm of using vape. And the question that we looked at was, among non-smokers, would ENDS facilitate nicotine dependence? And is it associated with adverse effects? What did we see? So among non-smokers, so hindi po ito nagsisigarilyo pero nagbe-vape, we saw that it is associated with future behavior of cigarette smoking. So it is a gateway, especially for the non-smokers, especially among the youth. It is associated with they will be eventual smokers. And will they continue to use e-cigarettes in the future? Yes, they will continue to use e-cigarettes in the future. Ang nakakatakot pa po would be the new electronic cigarettes have been designed in a manner they use nicotine salts. And what does this mean? It's more alkalinic, it's more absorbed through the stomach, and therefore, as you can see, the green line here, you get a higher nicotine level, concentration in your blood, and this is even higher than the cigarette nicotine content. And this is the first generation e-cigarette. So, of course, nicotine dependence will develop among these vapors because of the very high nicotine content. And unfortunately, with the transfer to DTI at present, it's so hard now to monitor if indeed they've stuck to their promised 3 milligrams per microliter of nicotine that they're supposed to adhere to. So this is really something. And then, do e-cigarettes affect the brain? Yes, of course, it affects the brain in a similar manner as tobacco. As I mentioned, in an adolescent, this is how their PET scan look. There's a prefrontal functional change in their brains, just similar to tobacco and even probably worse. We had a case in our institution in January, a 22-year-old male. He died from lung failure and heart attack. And vaping was the only risk factor identified. This is how his lungs look. So it is bad. And what is our term for this? This is an ARDS, or a severe acute lung injury. Our term is E-Valley, e-cigarette or vaping associated lung injury. So E-Valley po. D-Valley na po, no? Na magsigarilyo, mag-vape, at magkakaganito po tayo. And the patient, 22 years old, died from this. So, of course, kung pangit ang vape mo, pwedeng pumutok sa mukha mo, and this happened 5 years ago, na ano po yan sa news. There was also an ECG change in that person who died from E-Valley, and he underwent even an angioplasty pa, 2 vessels parado, all traced to vaping. These are the other organs that can be affected, of course, by vaping. So the recommendation of our body is we suggest among non-smokers and non-tobacco users not to use or to refrain from using electronic nicotine dependence delivery systems as well as heated tobacco products because of the harm that we saw and the tendency for it to be a gateway to smoking. Now, how about the smokers? So, ito po yung naging justification nila to pass the use of vaping in the Philippines, that it is an aid to help smokers stop smoking. So what we did was to compare it to the usual treatments that we do, like nicotine replacement therapy. And we can see here that the use of e-cigarette is not superior to use of nicotine replacement therapy in helping patients stop smoking. Therefore, among adults and adolescent smokers, there is insufficient evidence to recommend the use of vaping or electronic cigarettes to facilitate smoking abstinence. So here, there is insufficient evidence and further data have to be called. So my conclusion would be the following. Easy lang po, ABC lang po. So making smoking cessation a part of your routine practice and system will go a long way. It will increase the incidence of your smokers stopping smoking. And ABC would mean ask, a brief advice, cessation support. And e-cigarettes, as we've seen, is a gateway to smoking. It causes harm and is no better in helping smokers stop smoking. So remember these numbers po if you want to ask for help and for the quit line also. Thank you.
Thank you, Ma'am Lenny. And Dr. Fernandez had a very, very clear message to all of us. So tama ba, Raymond?
And po, you will see the hearts and all of the other emoticons. Very,
That's
very
right.
nice. Opo. And hopefully, marami pong nakakaano na po, no? Nakaka-remember kung ano po yung sinagot po nila sa kanila sa pre-test at ano po yung tamang kasagutan sa ngayon for the two questions po natin. Okay.
Okay,
So,
tama. So, may Q&A tayo later, right? But we will have to choose from the upvoted questions and encourage everyone to start typing in their questions. Pwede na po. The Q&A box is open already. Or even in the Zoom Q&A or the comment section of the Stop COVID Deaths or TVUP Facebook pages or in the TVUP YouTube channel. All right po.
Thank you so much, Ma'am Angge. We'll move on to our two reactors po. We have two reactors for today. The first of two reactors po is the chair of the Council on Clean Air, Tobacco, and Air Pollution, Philippine College of Chest Physicians, as well as the coordinator po ng Quit Smoking Hotline ng Department of Health. Please give a warm virtual welcome to Dr. Glina Ong Cabrera. Dr. Cabrera.
Hello po, good afternoon. So,
Yes po, go ahead, ma'am. Opo.
So, good afternoon po everyone. And thank you for inviting me and being able to react to Dr. Lenny Fernandez's presentation is really an opportunity din for me to share po with you our experiences. Experience namin ni Dr. Lenny not only dun sa smoking cessation program but also in writing. So naging very exciting po for us kasi nagkaroon po kami ng opportunity to help our mga kapwa Pinoy. So what do we do sa Quit Line? So going back, ABC po tayo. So nandun po kami pumapasok sa cessation support. But I'd like to give emphasis po yung importance po ng mga kababayan natin, especially po ng mga colleagues po natin sa healthcare, yung ask. Napakalaking bagay po ng role ng mga healthcare practitioners dun sa part na asking. Kasi kung hindi po tayo mag-ask, hindi po tayo makakarating sa C. And it's important also to realize that sometimes dun pa lang sa brief advice, marami na rin po ang tumitigil just by giving that brief advice from a family member. Minsan yun pa lang po, kahit less than 3 minutes, malaking bagay na. But for those po na hindi naman po talaga makastop dahil nga po sabi nila it's an addiction. It's a disease, hindi lang po siya habit. It's actually an addiction because it goes to the brain, triggering that dopamine pathway natin. So dun po pumapasok yung cessation support. And sa amin po sa Quit Line, actually it's housed po in the Lung Center of the Philippines. And we actually provide not only services po for the Quit Line, but we also have the outpatient clinic. So we also offer smoking cessation services for those who want to really see somebody face-to-face and share po yung experiences and challenges dun sa kanyang quit journey. And for those who are admitted at the same time na kailangan talaga, we also provide that service. So the Quit Line offers po the access. Kasi syempre po, lalo na po sa mga probinsya no, na hindi naman talaga in place yung tinatawag nating smoking cessation services, just by calling 1558 po, at least po meron pong sasagot. Sino po ba yung sumasagot? These are also healthcare workers, may psychologist po na nandoon po na naka-assign will actually answer. And during the past 2 years po, meron po tayong NRTs. So nakakapag-provide po kami ng what we call behavioral counseling or behavioral support or techniques or that will help that person to quit. And at the same time po, 2 years back, for that past 2 years, nakapag-provide po tayo ng NRTs for free. And that was the donation po ng World Health Organization. And yung sa napakita pong study ni Doktora, that was just the behavioral strategy wherein we just provided po the certain assistance and advice. And isa na po doon, when we deal with the withdrawal symptoms, we have the 5 Ds. So that's the delay. Mamaya, di ba tayo po mga Pilipino, mahilig manana habit. So dito po, pasok na pasok po. Dito po magiging advantageous yung ating manana habit. Yung mamaya na. So delay, drink water kasi kanina may nagsabi po, naglalaway. So nakakatulong po yung drink water and deep breathing kasi nakaka-relax. Kasi most of the people na nag-QOC ay usually under stress, may emotional concerns or psychological problems. So, or kung ano man po yung mga pinagdadaanan, sabi nga po nila. When we do at least deep breathing, nakaka-relax po tayo, nare-relax po tayo. At the same time po, nakakapag-isip. And then, distract, mag-isip po ng ibang bagay, yung something positive rather than focusing on the negative. And then, do something else. Mag-isip po at maggumawa at the same time ng mga bagay po na makakatulong rather than makaka-disturb or makakasira sa balance na nagaganap sa ating body at lalo na po sa ating lungs. So with that po, meron din, just to add po, do we also provide assistance dun sa mga nag-vape? Minsan po may tumatawag po rin sa amin na we're actually asking also assistance kasi gusto na rin nilang huminto sa pag-vape. So ibig sabihin po, talagang nagiging addictive na rin po siya yung sa vape. So nagustuhan ko po yung sabi ni Dr. Lenny kasi naghahanap ako ng word eh. Kasi sabi nila, it's safer. Bakit safer? Kasi po, regular cigarette contains 7,000 chemicals, but actually po, ang vape, dumadami na rin po yung chemicals niya. And from the last po na I read in the Wikipedia, nagiging 2,000 chemicals. And to name a few po, poisonous gases din po yung iba. Carbon monoxide, for example, may lead, may arsenic, yung iba po meron ding formaldehyde. So these are chemicals that can, even kahit konti siya, kahit 2,000 lang siya as compared to the 7,000 na in a regular cigarette, pwede rin po makadamage sa lungs. And in fact po, in our clinics, nakakakita na po kami ng unti-unting mga people, especially young adults, mga 21 years old, 22, 23, hanggang sa 27 years old. Not naman kasing damaged nung kagaya nung sa case ni Dr. Lenny, no? But when I did a CT scan in one of my patients na sabi pneumonia, parang asthmatic yung symptoms. We're trying to figure out kung ano po yung nagkakos ng hinga niya. May mga damage na po yung kanyang lungs. May mga fibrosis or meron na po mga tinatawag na ground glass opacities na ito po ay wala namang mga dating sakit. So apparently has been on vape for like 3 or 4 years. So we think it's not safer and we think it's not helping in smoking cessation, but rather than smoking initiation. So mas nag-uumpisa po sila manigarilyo and that's where our observation po na eventually nagsisigarilyo din sila. So tama po, for us, enemy po siya. Hindi po siya kakampi. Kalaban po natin siya in providing help in our patients. So I guess just to close lang po, if we need assistance po, call po 1558 and we will be ready to assist po and help you po. Thank you po.
Salamat, Dr. Glina. At maraming salamat sa inyong mga clarifications and especially mga emphasis sa point ni Dr. Lenny. Okay. So isa na lang, Dr. Raymond, our last
Yes,
speaker.
Yes, ma'am. Go ahead and introduce our last reactor, ma'am. Last speaker po. Opo.
So our last speaker is another reactor who is an associate professor and head of the section of addiction and dependence medicine. This is so important kasi we have the habit and we have to break it. And this time he is from the Department of Psychiatry and Behavioral Medicine of the UP College of Medicine of the Philippine
We have
General
not
Hospital.
started my video.
So, sir, we can hear you now. Very good audio. So we have to give this warm virtual welcome to Dr. Benjamin Vista. Sir, please turn on your video. Your mic is okay now.
Yes, may I request the host to start my video, please?
Sir, if you're seeing a prompt, you can
Okay,
click on it.
there
Yes,
you go.
go ahead.
Okay na,
Yeah,
sir.
the Wi-Fi is not too strong. So, good afternoon. Magandang hapon sa lahat. I am very honored and proud to be a part of this discussion this afternoon. I have known si Doc Lenny has been working on this for such a long time, and we in the department have been partnering with her for certain aspects of this, no? So this important project. Kaya sobrang natutuwa kami sa Department of Psychiatry and ngayon sa bagong division ng addiction medicine, no, na really are in support of this program. So let me just read a brief reaction of the whole division to what has been presented by Dr. Lenny, no? So as addiction medicine specialists and advocates for public health, we recognize the reality that nicotine remains the most addictive, and most accessible legal substance that our patients consume. Therefore, I am pleased to see the release of the updated Philippine Clinical Practice Guidelines on the diagnosis and management of tobacco use and nicotine dependence. These guidelines represent a crucial step forward in addressing one of the most significant public health challenges of our times. First and foremost, I commend the thoroughness and evidence-based approach taken in developing these guidelines and the rigorous review of the latest research and the inclusion of diverse perspectives ensure that healthcare professionals have access to the most up-to-date and comprehensive information to guide their clinical practice. So itong guidelines na ito are really pivotal, no, for the addiction medicine specialists also, offering evidence-based standards of care to address tobacco addiction effectively. It ensures consistent and high-quality treatment grounded in research, improving patient outcomes, reducing health risks, and facilitating multidisciplinary and transdisciplinary collaboration. These guidelines also aid in patient education, quality improvement, and adherence to ethical considerations as specialists grapple with the unique challenges and health risks posed by relatively emerging new forms of nicotine delivery that has been discussed in the lecture, ultimately enhancing the overall quality of addiction treatment and promoting a commitment to professional development and best practices in the field. One of the most noteworthy aspects of these guidelines is the emphasis on the use of pharmacologic therapy to facilitate smoking abstinence. Locally, we are limited when it comes to our choices in providing nicotine replacement therapy, as was explained by Doc Lenny. But I am hopeful that through this initiative, we can partner with advocacy policymakers to make more of these available to the public, no? Recognizing, of course, that tobacco use and nicotine dependence are major causes of mortality among Filipinos. These guidelines pave the way toward making these treatments available to all Filipino smokers and vapers. Emphasis on intensive behavioral therapies has also been highlighted. Napaka-importante po ito, which address the behavioral aspects of nicotine and tobacco use consistently over an extended period of time would better facilitate sustaining smoking abstinence in the long term. Furthermore, itong guidelines and these recommendations against the use of ENDS and ENNDS, no? Electronic nicotine delivery systems and electronic non-nicotine delivery systems to promote abstinence among Filipino smokers show the commitment of its authors to evidence-based practice. So, healthcare systems and providers should make it a priority to ensure that every interested patient receives appropriate guidelines and support for quitting smoking, as well as education on the potential dangers of using ends and ends. Additionally, with these treatment guidelines firmly in place, and these treatment guidelines are thankfully firmly in place, a conversation regarding establishing evidence-based prevention programs for these legal drugs should begin in earnest. I noticed that one of the chat entries mentioned that, no? Na perhaps we can already start these prevention programs. And I believe that since the treatment guidelines and these pathways are already firmly put in place, then perhaps we can expand the discussion, guys, to prevention. So, in conclusion, the release of these updated clinical practice guidelines on tobacco use and nicotine dependence is a significant milestone in the ongoing effort to reduce tobacco-related harm. It provides a clear roadmap for health providers and institutions to deliver more effective interventions and support for individuals trying to quit smoking. I look forward to seeing these guidelines put into action and make a positive impact on public health by reducing tobacco use and nicotine dependence in the country. So once again, from our division of addiction medicine at the UPPGH, congratulations to Dr. Lenny Fernandez and her team for a job well done. Mabuhay po kayo. Maraming salamat po.
Okay, thank you so much, Dr. Ben Vista. Thank you also for that congratulatory message po from the Department of Psychiatry and Behavioral Medicine. We at this point would like to ask all of our speakers po, including Dr. Cabrera, to open up their videos, and while they're doing that, we will be having a very quick break lang po for a special public service announcement for today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpe-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh, natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP, the COVID Communication Public Service Announcement, just one of the many creative outputs of the webinar team to push for COVID-19 vaccinations. Please share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, to get the ball rolling in our Q&A, si Ma'am Anggepo will ask the very first question.
Napakarami ng mga questions. Ang sipag nga ni Dr. Lenny, sagot na ng sagot. Pero let us share the question as well as her answers. So, ang tanong ni Mr. Joseph Tortona, Ma'am Lenny, can vaping really rid smoking, and can nicotine gum patches be used as an alternative? That's the million-dollar question now po. Ma'am Lenny.
So the last research question that we did showed that it does not really get rid of smoking, and even among non-smokers, it will pave the way, as sabi nga ni Dr. Glina, initiation of smoking, hindi smoking cessation. And then, yung mga smokers na gumamit ng vape, madalas sa totoo lang, in the end, nagiging dual smoke users pa sila. Smoke and vape sa sabay. Nagano na tuloy. And then, nicotine replacement therapy is not an alternative to vaping. It is a treatment, no? for smoking cessation and even for vaping also. Studies are showing that as well.
Oo, naku, ang daming mga tanong. Galit na nga yung iba eh. Why not just totally ban tobacco products in the Philippines and make tobacco growers shift to other agricultural crops? So ano yung masasabi natin bilang medical, as part of the medical establishment, how can we answer those concerns with regards, say, food security issues, agricultural production issues? Mayroon pa tayong masasabi, Ma?
So madalas to naging madalas to na talakayan, no? Hindi lang tayo concerned yung medical, pati yung Department of Agriculture. Pinag-aralan na po ito, and we have been trying for the past 25 years. Sa totoo lang, kasama yan sa Sin Tax Bill at sa Tobacco Regulation Act, na meron na tayong gradual na alternative na crop na production rather than tobacco's growing, or tobacco, yung tobacco na magtatanim at ma-manufacture. Tapos, hindi siya madaling sagot. No, sa New Zealand, as I mentioned there, they have totally banned 100% cigarette use and also tobacco growing agriculture or production. So, hindi pa natin kaya po yan kasi madami masasaktan, and continuous naman po yung dialogue tungkol dyan, because this is part of the tobacco control measures that we have promised to the United Nations also as a country.
All right. So may magandang tanong po dito kay Dr. Glena. Maganda, sinasagot na ni Ma'am Glena eh. But this is very important because we as health professionals are role models. So Dr. Ish Ludan is asking, how do we convince fellow MDs and healthcare personnel to quit smoking, especially within the hospital premises? Some of the MDs are actually very defensive and continue the bad habit in the hospital where I'm associated with. Parang alam ko yan. Some even smoke at the entrance to the clinics from the parking lot. And sadly, my clinic is right beside that area. So, Dr. Glenn, what do you think?
Actually, Doc, sinabi ni Dr. Lenny na Tobacco Regulation Act, that's Tobacco Regulation Act 9211. So, nandun din po yun, yung tinatawag na bawal manigarilyo sa pampublikong mga lugar. So, no smoking in public places. So, actually, kasama po, most especially po sa hospitals, playgrounds, and schools. Bawal din nga po magbenta within the school, dapat 100 meters from the perimeter ng school. So, what I'm just trying to say is there are policies and there are laws na nagpo-prohibit doon sa mag-smoke doon sa mga areas na yon. But yung personal na paghinto ng ating mga colleagues, I think we just really need to talk to them in a non-judgmental. Kasi usually doon po nagkakaroon ng samaan ng loob pag na-judge sila. But syempre, I'm sure alam na nila yan eh. Pero di ba usually po may mga kwentong may pinagdadaanan. So sometimes it helps just when we listen to them. Kasi may, di ba dun sa smoking cessation po, may tinatawag na 3-link chain. Biological, psychological, and socio-cultural. So, minsan hindi na-address natin yung biological part, pero yung pala may pinagdadaanan. So, usually pwedeng, let's just be a friend muna. But it's important for hospitals to set policies na hindi dapat naninigarilyo doon sa hospital at the very least.
Wow. So, sinasabi niyo may pinagdadaanan. I think Dr. Vista will be our greatest asset in terms of helping us give that message. Paano po, sir, ang pinaka-effective na kausapin yung mga taong either pasyente natin, colleague natin, o mahal natin sa buhay? What will be the best approach for them to be able to quit smoking? Sir?
Yeah, well, first off, I'd like to react muna to the question, why don't we just ban it and make it illegal altogether? Sabihin ko sa inyo, di ba, maraming illegal drugs, pero lumalaganap pa rin. Diba? So, ang problema dito, hindi naman siguro na to ban it because it'll just join the list of illegal drugs, which, well, it's very hard to control the illegal drug market, as you see. So, to answer the question about the current users, siguro as was mentioned earlier, there are many reasons why they are using this substance regularly, and we need to do assessments regarding physical, psychological, and social factors in their lives that make them not only, really under the influence and remain under the influence. What are the things that maintain their consistent use? So that's a very personal thing. On the general purpose of really decreasing this, as I mentioned in my response, we really need to start doing prevention. And by prevention, I'm not saying prevention to the adults who are already using, kasi treatment na yun. We should really start in educating the young as we can. Going to the schools and having prevention programs of tobacco and alcohol and all of these substances of abuse, so that early on, it's already part of the conversation for the developing brain. So, as I said, magaling ang ginawa ng guidelines ngayon kasi yung treatment part naaayos na. So, why is that good for the current users? Kasi meron nang pupuntahan na treatment eh. The conversation, for example, about saying it is an illness. So, even just that, it's not just an illness, but there are treatments for the illness. So this is where these guidelines are so great. Now, we can now move forward, or rather backward, in saying that maybe we can start the conversation for the younger generation, the ones, really as early as kindergarten, and start talking to the parents and the teachers to have a conversation so that the child grows up knowing the dangers of these substances, and they can make a choice for themselves. So I think that's my answer to the question. Salamat po.
Meron pa ba tayong question, Dr. Raymond?
Actually, gusto ko yung sinagot ni Ma'am Lenny, but the question, I'll read it po, It's a question from Patrick Encarnacion. Do you think including community pharmacies in the network that captures smokers and monitors progress will increase the smoking quit rate? I believe this is a very effective practice in other countries. Will this type of collaboration work in the Philippines?
Yeah, so I answered that yes, this is a very good area to explore and to increase nga yung partnership. So hindi nga lang naman ang healthcare workers tayo lang po na nagka-handle directly na pasyente. The pharmacies, the pharmacists are very much part and parcel of our community, and talagang dapat pati sila sinasama din po sa fight natin against smoking. So lalo na over-the-counter po ang nicotine replacement therapy. Sa totoo lang, hindi kailangan ng prescription po yan. But where do they buy that? From the pharmacies. So yes, the pharmacies, sila nga nagtuturo nga, di ba, kung paano gamitin sa amin yung mga inhalers. All the more na mas madali po na we equip them with the skills to help our smokers use also properly, for instance, the NRT. Thank you. We'll do that.
Thank you
Thank
po.
you.
Ma'am Glina, go ahead.
Just to add po, Doc, some of the pharmacies have already reached out dun sa PCCP before, and we have already conducted seminars with the pharmacists because they actually realized their vital role. Kasi minsan, di ba, pagpunta mo lang sa Mercury or sa drugstore, di ba? Minsan, ano yung gamot po sa ubo? Minsan, nagtatanong sa kanila. So, may mga ganung scenario po na parang minsan they are being asked. So, they realize their importance. So, they're actually moving also towards that direction as well.
Oo
Thank
nga,
you.
nakikita ko how come napakalakas ng advertising ng tobacco and tobacco products, and even in social media, the influencers are vaping left and right, even among the youth models purportedly, but we don't have an advertising on smoking cessation products. Kailangan ba nating mag-legislate to be able to fund that? What do you think? Ma'am Lenny, what do you think?
Kasama po yun sa sin tax bill na yung makukuhang taxes dapat napunta doon. So, syempre, madaming priorities po ang bawat agency. There was a time na nakita ko sa TV siya. No? That was 8 years ago. So, depende kung may budget. But it is not something na systematized on a sustained basis, unfortunately.
Okay. So meron pa rin po something about the sin tax law. Comment, but I don't know if you would like to comment din po the effectivity of the sin tax bill, sin tax law. It's been observed that people would still buy cigarettes and liquor and then scrimp on food items dahil they're allotting it to cigarettes and liquor. The question naman po that I received also was, is there anything that can be done in terms maybe paspaigtingin pa po yung implementation, or does the sin tax law need to be amended so that it's a little bit stricter po, Ma'am Lenny?
Yeah, so syempre hindi kami kasama dyan at present, but it was supposed to be graduated na i-increase pa lalo yung sin tax, and then dapat may evaluation in terms of its implementation. So I think DOH will go into that together with the other agencies as well. At i-remind na rin natin sila ulit. Thank you.
Thank you po.
Okay.
For Dr. Vista. Sir, comment po on parents who also ask their small children to buy cigarettes on their behalf from sari-sari stores.
Yeah, so that's really a phenomenon that really is counter the whole principle, no? So, and this is where really, as I said, the discussion has to start, about efforts to really educate people and to make them knowledgeable. I think, in my own personal opinion, we really need to start with the parents and the teachers. And maybe, as I said, prevention programs can actually help that. Now, if that can't be done, then at the level of the LGU, diba? The barangay, na merong mga efforts dyan to tell them about, the dangers and to help them assess that particular behavior, Raymond, or something else that they're doing na sila ang bibili. It works the same for alcohol, no? So, the studies on alcohol says that usually the influencers for the young are really people at home, no? Somebody there, at home. So tama ho yan, and kailangan nating umpisahan yung usapan na yan at the level of the parents and the teachers and the carers for our young. So thanks.
Okay. Oh, naku, tama. So, pupunta na ba tayo sa Slido answers?
Yes po,
Raymond?
yes po. So can we have that on the screen? Thank you, Ma'am Angge. Thank you also to our speakers for that interesting po, meaningful na exchange of ideas and answers po. Can we have on the screen the Slido as well as the fun quiz poll po natin?
Habang hinihintay natin, hihingin ko po yung opportunity for our distinguished speaker and panelists to formulate yung one last parting words later on. But go ahead, Raymond.
Sige po. We're seeing naman po, teka, let me relaunch not relaunch. Share the results. So we're sharing the results as shown here. In the Zoom, I'll read the questions po, and then I'll let Ma'am Lenny answer. The questions came from her. The first question is, what are the ABCs in helping smokers stop smoking? Correct answer, Ma'am.
So B ang correct.
B is the correct answer. So in the Zoom po, you will notice that 38% of those who participated answered B. Yun po yung most selected. Next is letter D, ask brief support and counsel, 28%, and letter A, ask brief advice and counsel. Wala pumili ng convince, no? Baka nahirapan silang mag-convince sa letter C. Question number 2, Ma'am Lenny reads, the following are established harmful effects of vaping, except
Siyempre, testmanship, letter D.
None of the above. So doon po sa mga ano po ano yung if you were really intently listening kay Ma'am Lenny in terms of yung acute lung injury dahil sa vaping, yun po yung letter A po natin. That's what is the second most selected po na answer in terms of the Zoom, but here in Slido, gateway smoking po yung pangalawa. Okay, so right now we'll move ahead with the panel discussion as well. Panel discussion evaluation poll po natin. Can we have that be flashed on the screen? Thank you so much. So si Ma'am Angge has already primed our speakers po, no? Please take that for our speakers. Please take this time to formulate your parting words po, something that you would like the audience to take away from the webinar. As I read through these 5 questions and our participants answer this, wala na po kaming hiwalay na nilalabas na evaluation poll. Ito na po iyon. So I'll read the questions. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this panel evaluation poll as we move on to the parting messages from our speakers. Go ahead, Mama.
Okay. Thank you, Dr. Raymond. Now let us ask each and every panelist to be able to give their take-home message to our audience. So let us start with Dr. Ben Vista. Sir, please. The floor is yours.
Yes, so thank you again for inviting me, and in behalf of the Division of Addiction Medicine, kami talagang all admiration and awe for the work of Doc Lenny and her team. We're always here to help and support. And again, I just like to reiterate that in order to combat the very powerful tobacco lobby and alcohol lobby in Congress, it's very hard to combat that toe to toe, and we must find another way, and that is really through prevention measures. But and I hope we can find a way to find resources to really start evidence-based prevention here in our country regarding the legal drugs. Thank you.
All right. Thank you, Dr. Ben. And let us now move to Dr. Glina Ong Cabrera. Doc, please, your words.
So let us all work po for a healthy Philippines, healthy Pilipinas, and a healthy future po. So we have to protect the youth who are actually the future. And we also hope that our youth and our country will invest most especially to health, because health is wealth. Yun lang po. Thank you po.
Maraming salamat, Dr. Glina. And now, natutuwa ako, Ma'am Lenny, meron nang nag-networking sa inyo sa chat box. So shout out kay Dr. Diana Orolfo, the co-chair of the Philippine Pharmacists Association Advocacy Committee. So talagang maraming nag-get in touch and everybody is on board to help your advocacy. So please tell us in a few words po kung paano po ang maitutulong namin sa ating kampanya. Go ahead, Ma'am Lenny.
Salamat po sa pagdalo today. And then kung galing man kayo from Ilocos down to Pagadian, down to Zamboanga, may magagawa po tayo sa ating mga naninigarilyo at nagbe-vape. We can help them stop smoking and vaping. Just follow and remember the ABCs. So A is ask wherever you are kung sinong naninigarilyo. B, just give a brief advice. 3 minutes lang po. And letter C, cessation support. Kung wala na kayong tiyaga at oras na gumawa niyan sarili nyo, you can refer to the quit hotline or to the smoking cessation programs. And electronic cigarette, e-cigarettes, e-valley na po. Thank you.
Salamat, Ma'am Lenny. So, Dr. Raymond, ating panel discussion evaluation poll, ready na po?
Ready na po siya. I think 64% at least right now, pero we will not be closing this po until the end of the webinar. Based on the results of our panel discussion po, at least 95% of our participants who participated po dito po sa ating evaluation poll indicated that they strongly agree with all of the statements. We're very, very thankful to Dr. Lenny Fernandez, Dr. Glina Ong Cabrera, and Dr. Benjamin Vista for taking the time out and just really participating in this rich exchange of ideas po with regards to smoking cessation. So for our synthesis and closing remarks, that will be introduced by Ma'am Angge.
Okay, now to formally close this webinar, eto po ma'am. Here we are again, and let us hear a brief synthesis and closing remarks from none other than the head of the Office of the Expanded Education and Training of the Philippine General Hospital, si Dr. Stella Marie Jose. Ma'am, please.
Good afternoon, everyone. This is a very interesting webinar that we had today, and I hope everybody learned from it. From Dr. Lenny Fernandez, she said that we should make smoking cessation a routine part of our practice. So as doctors, as healthcare workers, it should be part of our practice already. She said that it's as easy as ABC. A stands for ask, and B, a brief advice. So you don't give the whole caboodle to them, just a short advice. And C is cessation support. So cessation support can be in the form of pharmacologic therapy or psychiatric help. Okay, so, and she mentioned that e-cigarette is a gateway to smoking, and it causes harm. You know, people think, you know, if you heard our POTS, the person on the street, they think that vaping is it's not harmful, no? And so she said that vaping is no better in helping smokers to stop smoking. Okay? So it doesn't help at all. From Dr. Glina Ong Cabrera, who's the chair of the Council on Clean Health, Tobacco, and air pollution, she said the 5 Ds. Okay, so D, the first D is delay. Delay a little bit the start of smoking. And B, drink water because it makes your throat dry when you smoke. Do deep breathing exercises. You should relax. B, for distract or do something else. No? And the last B is also yes, do something else. Okay, so you don't have to grab that cigarette at once. Okay, and she mentioned that the hotline is 1558. You can call that number. Now, from Dr. Benjamin Vista, who's from the Department of Psychiatry, Division of Addictive Medicine, he said that nicotine is the most addictive of all substances, and they welcome referrals to their division. He emphasized that in the clinical practice guidelines, there is emphasis on pharmacologic therapy, and that is very important. He said that we should make this more available to all Filipinos. And by the way, in that question that you asked the children to buy cigarettes for you, I think that's really wrong because it puts in their mind that cigarettes are not harmful. So even as children, they already get the wrong message. So that's all. Thank you for listening.
Salamat po, Ma'am Stella. And salamat again for capturing the essence. Yeah, we're capturing the essence of this very interesting webinar with your excellent synthesis and closing remarks. And next week, this is something very exciting. We will have another topic that will be very, very controversial. Controversial ba to, Raymond? Oo, parang usong-uso to ngayon. Oo. Anyway, we have a lecture, or rather a speaker from the Division of Plastic Surgery, who is also our Associate Dean of the UP College of Medicine. He will discuss safety issues in plastic and cosmetic surgery. It's a special topic on September 29, 2023. So napaka-exciting nito. Parang gusto kong manood talaga. In the meantime, you can still watch us on playback at the TVUP YouTube channel and at the TVUP Signal TV channel 101.
Thank you, Ma'am Angge, and thank you to Dr. Stella for that very concise pero malaman po na synthesis and closing remarks. So before we conclude our program, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel for your convenience. So you just open up either the YouTube app or you open up your browsers, enter www.youtube.com/TVUPPH for you to be able to see all 163 webinars, and then after today it will be 164 webinars po. We also understand everyone very busy, so we have this what we call SCD shorts na very easily to consume po, whether you're waiting for someone at the bus stop or at the LRT for your coffee, you can, or at the convenience store, you can watch them po very quickly at your convenience at the TVUP YouTube channel as well. So this formally closes our webinar for the week. Magkita-kita po tayo again next Friday from 12 noon to 2 p.m. It's a date.
Okay, so together we can stop COVID deaths, hindi lang sa COVID, but sa marami pang iba na pwede nating iwasan. So we have all to keep safe. Tama, Raymond?
Yes po. Yes, ma'am. So keep safe, keep healthy, and see you online.
Thank you.